Okay, let's take a look at your chart here, MJ. And when's the last time that you were in? It looks like they said it's been a while and they marked you as a new patient.
No, it's probably been about 7 years.
Okay, and have you been seeing another chiropractor since then, or?
Unfortunately, no, I haven't.
Okay, and what brings you in today?
A lot of low back issues.
Low back.
Lots of pain.
Okay. And would you say that your pain is constant, or would you say that it's more of a shooting pain or stabbing pain?
Well, it's very situational, but when it happens, it's like a shooting pain.
And is that on one side?
It's like central, it seems like.
Okay, do you notice it more when you're sitting or standing?
Anytime I hinge.
Okay, so probably some lumbar, thoracic extension. Okay, so what we're going to do today is going to be a full exam.
Okay.
And we will check your entire spine. What I'll have you do first is change into this gown and leave the opening in the back. Just remove your shirt. You can keep your pants on, okay? And then I will be back in just a moment.
Okay.
Okay, so I'm just going to have you go ahead and turn towards the wall. All right, and then place your feet fully together for me. Okay, put my glasses on. Let me know if you have any pain.
So far, so good.
Okay, just checking the vertebrae alignment. Everything looks even. I don't notice possibly a slight hip dysplasia on the right side. Just going to jot this down. So basically that means just a posture imbalance. Where you lean more towards the right side.
I see.
Do you happen to notice that this side gets more of that pain you described? Or would you say it's...
maybe it's sometimes maybe off to the right, possibly.
Okay.
I should do a better job.
I'm just going to
paying
have
attention
you
to that.
sit down. Okay, I'm just going to put some gloves on here. All right, and have you turn your head all the way to your right shoulder as far as you can. And to your left shoulder as far as you can. All right, check your cervical extension. Can you put your head all the way down, chin to your chest as far as you can go? Perfect. Stay just like that for me. Any pain?
No.
Okay. Let's see. All right. So that all looks good. Let's go ahead and check some of the vertebrae mobility. And I'll be using, as I like to call, my helping hands.
Okay.
So. If you have any pain,
No.
just let me know. Could you bend down more for me? Slight variation
You found the stud.
in T5 and perfect. All right. Now I'd like to test your range of motion with this part of your spine. So this is going to be your thoracic and lumbar spine. Sorry for my clearing on my throat and just getting over a cold. All right, so I'm going to have you just bend over, check your flexion, and now straight up and extension. And one more time for me. Bend all the way over. Perfect. And extend all the way back up. Perfect. Shoulder blades go back good. No kyphosis, no lordosis. That's good news. Okay, now if I can have you turn your whole body kind of this way, like that. Any pain here?
No.
And to the opposite side? Any pain here?
No.
Okay. All right. All right. Let's see. All right, so we already got your postural asymmetry down. Now what I'm going to have you do is we are going to do a sharp or dull test. And you're going to tell me to check your neurological system on each side to make sure there's not some nerves pinched over here first. Here, I'm going to do a sharp. I'll show you what sharp feels like. And I'll show you what dull feels like. Okay?
Okay.
So I'm going to touch you with one of these. And you are just going to tell me if it is sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. 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 I think sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Dull.
And can you place your head down?
Sharp. 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 Dull.
All right. Perfect. just going to perform a bit of a reflex test on you. All right, so just go ahead and relax. No need to be tight or anything. You're doing great.
Thank you.
Let's see. We did cervical rotation, lumbar palpitation, thoracic extension. Cranial nerve exam included the sharp or dull. Cervical strain was good. No muscle spasms. Slight postural imbalance. Sciatic nerve. Doesn't seem to be agitated currently. Slight postural asymmetry on the right side. And lastly, what we're going to be doing is called, well, it's more of a cranial nerve exam, similar to the sharp or the dull test that we just did. Okay. So I'm going to be placing an object on your skin, and you're going to tell me either warm or cold. Okay. Now, the warm one is not hot warm. We'd say it's more so just regular room temperature. Mm-hmm. The cold one will feel more cool, not very cold, not freezing.
Okay.
Okay. This is warm.
Yeah.
This is cold.
Okay.
All right, are you ready?
As ready as I ever will be. That's cold. 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 Warm. 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 Cold. 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 Warm. 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 Cold. 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 Warm. 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 Cold.
Perfect. All right. Let's go ahead and just look. Go ahead and bend down a little bit for me so we can protrude the spine. 1, 2, 3, 5, 6, 7, 8, 9. Thoracic 7, 8 is a little bit unpronounced. 10, 11, 13, 14, 15, 16, 17. Sacral spine feels fine. Have you ever fallen in sports on your bottom?
Yeah.
Okay, that's common. Okay, just going to feel the latissimus muscle. Make sure nothing's pulling. Do you ever feel a tightness right here?
I can't recall specifically if I have or not. Maybe I have at some point.
All right. Just going to use a slight red therapy light all the way down the spine. Slightly warm feeling, but should not be hot.
Do you have a lot of appointments today?
We have quite a few, but I'm not really sure. I don't keep track of them. I just take them as they give them to me. I tell them no overbooking, no more than 3 patients per hour.
Yeah.
Okay, that's good. Just gonna write down some notes really quick. Let's see. Balance sensation was good. Neurological test. All right, so now I'm gonna have you actually do something with your arms. So I want you to just slowly extend just the right one straight out. Okay, and move it upwards. Okay, and back down slowly. Okay, perfect. And now on this side. And back down. All right, good. And could you reach both arms straight upwards above your head? Any pain?
No.
All right. Slow movements without pain. No inflammation. Foot placement is standard. No issues. All right, Mr. MJ. Well, it doesn't appear that there are any major issues today. There is, again, a slight imbalance to the side we are leaning. I don't believe it is actually the vertebrae because they feel even. I think that maybe when you're working or something that you do in life that you're just leaning to the side, so your muscles tighten up on this side and kind of pull you.
Yeah, that makes
Or
sense.
similar to torticollis of the shoulder when it pulls your neck, so it's like a torticollis of this area. But that pain that you're describing that you had, you said you don't have now, so that's not a worry. I would just recommend, if you do start having that pain again, call us while you're having it, and then we can take an x-ray and see what is pinched. It's probably most likely the sciatic nerve is probably pinched on the right side because of that lean over here.
Okay.
So that's probably what is going on. And you might also have some degenerative disc in this lower back. Do you lift weights?
Yeah.
Okay. Well, that's quite normal as we age in the lower back, especially when we're lifting things. So we will keep an eye on that and see, if we need to do a thoracic fusion in the future. Other than that, you are welcome to come back for a checkup or whenever you're having pain, okay?
Okay. I appreciate it.